इस भिडियोमा हामी गएर पढ्न के पेरिटोनियम पेरिटोनियम के पेरिटोनियम भनेको लार्जेस्ट लेयर हो। यसको के हुन्छ पेरिटोनियम पेरिटोनियम के हुन्छ सेरस मेम्ब्रेन हुन्छ। सेरस मेम्ब्रेन फर्म द सेरस सेक फर्म के बनाउँछ सेरस सेक सेरस मेम्ब्रेन हुन्छ जुन चाहिँ सेरस सेक बनाउँछ। यसको दुईटा लेयर हुन्छ पेरेन्टल लेयर अनि विसरल लेयर। अब यसमा के हुन्छ हाम्रो सेल पाउँछ कुन सेल आउँछ मेसेन्थेरियम सेल आउँछ। मेसेन्थेरियम सेल के गर्छ सेक्रेट गर्छ कि सेक्रेट गर्छ फ्लुइड गर्छ कस्तो फ्लुइड सेक्रेट गर्छ सेरस फ्लुइड सेक्रेट गर्छ। अब हामी यसमा हेर्दाखेरि यो जुन हाम्रो अर्गनसँग एट्याच छ त्यसलाई visceral peritoneum भनिन्छ। अनि जुन हाम्रो यो यसरी फोल्ड बनेर बाहिरतिर आइरहेको छ यसले पेरेन्टल पेरिटोनियम भन्छ। अनि यो parietal पेरिटोनियम अनि यो visceral पेरिटोनियमको बिचमा जुन स्पेस छ नि यो स्पेसलाई के भन्छ अरे पेरिटोनियल क्याभिटी भनिन्छ। सो द पेरिटोनियल लेयर parietal peritoneal lies inner surface of the एब्डोमेनको भित्रतिर हाम्रो हुन्छ। अनि यो के हुन्छ यो एब्डोमेनको भित्र अनि पेल्भिसको भित्र पेल्भिस यो पेल्भिक लेयर जुन छ नि पेल्भिक मसल त्यसको भित्र हुन्छ इनर डायफ्राम। अनि यहाँबाट हाम्रो डायफ्रामको भित्रतिर हुन्छ। हामी visceral पेरिटोनियम हेऱ्यौँ भने अनि parietal पेरिटोनियमको अर्को एउटा के हेरौँ parietal पेरिटोनियम जुन छ नि क्यान एस्टिप यसलाई निकाल्न सकिन्छ स्टिप एन्ड डेभलप फ्रम द सोमाटोप्लुरिक यो केबाट डेभलप भएको हुन्छ सोमाटोप्लुरिक इन्ट्राइम्ब्रोनिक लेटरल प्लेट अफ मेजोडर्मबाट भएको हुन्छ। केबाट भएको हुन्छ यो सोमाटोप्लुरिक इन्ट्राइम्ब्रोनिक लेटरल प्लेट अफ मेजोडर्मबाट हुन्छ लेटरल प्लेट मेजोडर्मबाट भएको हुन्छ। अनि यो चाहिँ हाम्रो जुन parietal पेरिटोनियम जुन छ नि यो चाहिँ हाम्रो पेन सेन्सिटिभ हुन्छ नर्भ सप्लाई यसमा भएको हुन्छ त्यही भएर पेन सेन्सिटिभ तर visceral पेरिटोनियम हाम्रो पेन सेन्सिटिभ हुँदैन। visceral पेरिटोनियम क्यान नट बी एस्टिप visceral पेरिटोनियम निकाल्न सक्दैन। त्यसपछि हाम्रो insensitive to pain tactile and thermal sensation so it is not in supply by any nerve to the sensitive to the pain tactile and thermal sensation and sensitive to the ischemic pain or pain due to the distension of or stretching of the sensory visceral afferent. So there is a visceral reflex motor activity so responsible for the referred pain. So ischemic pain or pain due to the over distension or stretching pain in the visceral layer visceral afferent is sensory supply of the visceral afferent so that the visceral reflex motor activity lead to the like refer pain like so when you look anterior and posterior this is the anterior this is the posterior and when you look this so first of all we discuss this intraperitoneal organ and retroperitoneal organ. The intraperitoneal organ means के हुन्छ हाम्रो कि कम्प्लिटली कभर्ड विथ द visceral peritoneum। अब के भयो चाहिँ हाम्रो यो अगाडिको इमेजमा हेर्दाखेरि यो हाम्रो visceral peritoneum छ नि यो पुरै कम्प्लिटली कभर गरेको छ यसरी आएर यो पुरै कम्प्लिटली यो अर्गनलाई कभर गरेको छ यो अर्गनलाई कभर गरेको छ भने यिनीहरूलाई इन्ट्रापेरिटोनियम भनिन्छ। यदि यो visceral peritoneum or visceral peritoneum or the this parental peritoneum is covering partially or one sided of the organ another side is not covered. This is one side is covered one side is covered another side is not covered. These are known as retroperitoneal and there is also primary retroperitoneal secondary retroperitoneal we discuss here. So first intraperitoneal this is covered by the visceral organ visceral peritoneum. So these are stomach first part of duodenum first part of duodenum like 2 cm after duodenum jejunum ileum transverse colon sigmoid colon liver and spleen. These all are the intraperitoneal but in the retroperitoneum it's partially covered or peritoneum covered by the peritoneum partially covered by the peritoneum. So there is a kidney ureter suprarenal gland and rectum. These are the partially covered these are known as retroperitoneum. So when you look there is a retroperitoneal organ is a primary and secondary. Primary means initially covered by the retroperitoneum but after the time of interval it is also covered by the parietal peritoneum. But the secondary that is covered initially by the parietal peritoneum but after that sometimes they go to degenerate. So these are the like the duodenum ascending colon and descending colon pancreas and rectum or kidney ureter and the suprarenal gland are the primary peritoneum. So when you look the intraperitoneal and retroperitoneal difference so there is a like in the retroperitoneal there is a second third and fourth part of duodenum but in the intraperitoneal there is a first part of duodenum stomach jejunum ileum cecum appendix transverse colon sigmoid colon liver gallbladder tail of pancreas and spleen are fall in the intraperitoneal organ. And regarding the retroperitoneal there is second third fourth part of duodenum ascending descending colon rectum head, neck of body of pancreas, head, neck, body of the pancreas, kidney, ureter, supranucleus, abdominal aorta, and inferior vena cava. These are the retroperitoneal organ. So when we look in this image, so this is the diagram, and before in between this diagram there is like this is parietal peritoneum, this is visceral peritoneum. Okay, this is visceral peritoneum, this is parietal peritoneum, and these both are attaching and forming the lesser omentum. यसलाई हाम्रो के भन्छ लेसर ओमेन्टम बनाउँछ अनि लेसर ओमेन्टमले के गर्छ लिभरलाई स्टमकलाई लेसर ओमेन्टमले के गर्छ हाम्रो स्टमक अनि हाम्रो लिभरलाई एट्याच गरेर हाम्रो होल्ड गरेर राख्ने काम गर्छ त्यसपछि आउँछ हाम्रो यो स्टमकको पोस्टेरियर साइडमा अनि स्टमकको पोस्टेरियर साइडमा जति स्पेस छ त्यसलाई लेसर सेक भनिन्छ अनि स्टमकको एन्टेरियर साइडमा जति स्पेस छ त्यसलाई ग्रेटर सेक भनिन्छ अनि जुन स्टमकबाट हाम्रो आइरहेछ नि यो ओमेन्टम यो चाहिँ आएर हाम्रो ड्युडेनमलाई ग्रेटर के भन्छ ड्युडेनम कोलोनरलाई कभर गरिरहेछ यसलाई हामी के भन्छ ग्रेटर ओमेन्टम भनिन्छ ग्रेटर ओमेन्टमको अरूपट्टि 4वटा लेयर हुन्छ दिस इज द this primary this is 4 layers after that pancreas is partially covered duodenum is partially covered but here is the here is a small intestine is fully covered and rectum and bladder is partially covered from one sided. This is known as retroperitoneum. This organ is retroperitoneal and this is the aorta is also a partially retroperitoneal. So this is regarding the retroperitoneal. So regarding the peritoneal ligament, there is a double layer or fold of the peritoneum is known as peritoneal ligament. So it's connected the organ to the organ or organ to the abdominal wall. So first there is a coronary artery ligament, coronary ligament, falciparum ligament, gastroparetic ligament, gastroduodenal ligament, gastrocolic ligament, gastrosplenic ligament, splenorenal ligament, splenocolic ligament. This gastrohepatic means the stomach is connected to the liver. Gastroduodenal means the stomach is connected to the duodenum. Gastrocolic stomach is connected with the colon. This and gastrosplenic means the stomach is connected to the spleen. This ligament are formed from the peritoneal layer and two fold of peritoneal layer or double fold of peritoneal layer follow this ligament. Note the ventral mesentery and the present in the foregut. Ventral mesentery and when you look in this image development, these are the ventral mesentery, these are the dorsal mesentery. So ventral mesentery only present in the foregut, but dorsal mesentery present in the foregut, midgut, hindgut also. So midgut, hindgut only dorsal mesentery, and there is a mesentery of the jejunum, ileum, mesoappendix, transverse colon, sigmoid colon. Mesentery of these are the mesentery of the jejunum, ileum, mesentery, mesocolon, mesoappendix, transverse colon, and sigmoid colon. Omentum, peritoneal fold connect the stomach with the other abdominal organs like greater omentum, lesser omentum. Greater develop from the dorsal mesogastrium, and greater omentum is the ventral mesogastrium. Develop from the ventral mesogastrium, like only this is the anterior, this is the posterior. So this form the greater omentum, this is from the lesser omentum. Now stomach rotate 90-degree axis to the right and anterior border, right posterior border left. So the portion of the ventral mesogastrium absorb and develop liver divide and the ventral mesogastrium in two segments. So here is the lesser omentum. So this is a stomach. Initially a stomach. This is the stomach and it's rotate initially and it's rotate into left to right, and when it's rotate, so here is a lesser omentum, split into portion, and here is a liver, and posterior side there is a greater omentum. So right border lesser omentum is present in the foramen of Winslow. Foramen of Winslow. So dorsal mesentery divided by the spleen. Dorsal mesentery divided by the spleen. Dorsal mesogastrium. Dorsal are there is a developed dorsal mesogastrium developed into the gastrosphenic ligament, splenorectal ligament, and then greater omentum. Greater omentum pulls on abdomen because of the its help to the control the inflammation infection in the abdominal organs. Largest fold of the peritoneum, like apron, cover the loop of the intestine and also made of the 4 layer. So contain fat, small arteries and vein, gastroepiphylic artery, branches of gastroepiphylic artery. So primary layer from 4 layer, first layer from 4th layer, second layer from 3rd layer. Like this one, this. When primary layer come and go, this is secondary layer go into third. So this is 1, 2, and this is 1, 4, and this is 2 and 3. So and that way this converted into 4 layer. Regarding the lesser omentum, this is a hepatogastric ligament and which from the hepatoduodenal ligament and hepatogastric ligament. So behind this lesser omentum there is a lesser sac of space. Lesser curvature of the stomach is first to see of duodenum to the liver. Lesser curvature of the stomach and the first to see of the duodenum to the liver like connect गर्ने काम गर्छ lesser अनि stomach लाई. त्यसपछि हाम्रो के हुन्छ यसको कन्टेन्ट के हो त राइट फेरि मार्जिन हुन्छ along with the lesser curvature. So proper hepatic artery portal vein हुन्छ, bile duct हुन्छ, lymph node हुन्छ, lymphatic hepatofluxus हुन्छ. त्यसपछि along the lesser curvature के हुन्छ हाम्रो त राइट एन्ड लेफ्ट ग्यास्ट्रिक भेसल एन्ड lymph node हुन्छ जुन चाहिँ ब्रान्चेस अफ द ग्यास्ट्रिक नर्भ हो. क्लिनिकल एनाटोमी हेर्दाखेरि यसमा के देखिन्छ हाम्रो ओमेन्टल ग्राफ्ट देखिन्छ जुन चाहिँ ग्रेटर ओमेन्टमले हाइली भास्कुलर हुन्छ. ओमेन्टम ग्राफ्ट गरिन्छ किनभने ग्रेटर ओमेन्टम जुन चाहिँ हाइली भास्कुलर हुन्छ अनि फास्ट हिलिङ पर्पजले गर्दाखेरि गरिन्छ.